she'd feel right at home here. My wife is a family practice physician.
Okay.
She'd feel right at home here on the target range. Your task as governor is going to be particularly daunting because not only do you have a mess to fix in the state, but now we also need a governor that's going to protect us from federal overreach. Are you willing to empower our Attorney General, pull every legislative and legal lever, and go to the mat to protect us from the federal government?
Yes, hands down. And a number of issues, but you mentioned health care. It's a prime one. I called this week. Actually, I talked with J.B. Van Hollen this week, and I was happy to see today he asked for that help from the governor and the legislature. I called on him as of Monday. Paul Ryan and I grew up down the way from each other. When I was in Walworth County, he was in Rock County. It makes me proud that he's from Wisconsin. But Paul and I talked about this early on Monday morning. I've talked to other governors from across the country, and we've got 4 things we've called for. One was legal action, which I'm glad JB is asking the governor and the legislature to give him the power to do that, because we need to join with the other 14 other states that have attorney generals demanding that the federal government give us our rights back, our rights to control our own health care in our own states, and not have the federal government dictate that to us. Secondly, as governor, by January 3rd, when I get the chance to serve as your governor, I will sign any and all legislation that clearly lays out Wisconsin's intent where legally possible to opt out of the federal health care mandate. As my wife and my family know, not because we're practitioners, but because we're patients, health care is an incredibly personal decision. And we should have that decision not just at the state level, but at the family level and community level. We shouldn't be having the federal government, which has messed up so many other things, be the ones dictating to us who we can see, how we can see, and what kind of health care decisions we're going to make in the future. We were so pumped up about that answer there.
Just a quick question. It's kind of going off of the healthcare issue. Looking out at, say, 2014 to 2019, and let's say a lot of this, the things that are trying to be done to overturn some of the mandates from the state don't occur. Let's just say, they fail and the courts, don't agree with it. What that leaves us then, especially say on the Medicaid side, and Terry, this is going to be important for you as well, is over $300 million in the span of 5 years, if not more than that, that is going to have to be absorbed into the state.
Yep.
And, just kind of looking long range, what are you thinking is possible, because it's going to have an impact in taking resources from other places as well?
Yeah, well, it's one of those, it's interesting, since the plan passed, up until Sunday it was all process reporting in the national media. Suddenly after it passed, it was all this glorious, only talk about the wonderful things and kind of gloss over the details of the bill, mainly because nobody, including most members of Congress, had actually read it. But the reality is there are 3 really fundamental reasons why it's a problem. One is the personal one for all of us, that I don't want the federal government dictating to my family or anybody else's family how they deal with health care. 2, from a philosophical or constitutional standpoint, I'm not a lawyer, which maybe is a good reason to vote for me for governor. but the reality is, although Jim Doyle and Tom Barrett are, I should point that out. But the reality is, so I don't know every nuance of the law, but I have read the Constitution, and I have read the Bill of Rights. And to me, the Constitution, nowhere have I read that the federal government has the right to control our individual health care. I have read the 10th Amendment into the Bill of Rights, which clearly says if the Constitution doesn't lay something out as a responsibility of the federal government, that is inherently a right of the states. So I hope that on the principled point that the government has no business in my health care, I hope on the second point that the Constitution clearly shows they have no right taking it away from the states, and third, from a purely parochial or practical standpoint, the fact that I am already looking at a budget deficit that is nearly $1 billion more than Jim Doyle had 2 years ago before his last biennial budget. The last thing I can afford is hundreds of millions of dollars in higher Medicaid costs that are nowhere accounted for in this federal legislation. That is why one of the biggest bits of financial malpractice has been the fact that Jim Doyle allowed politics to keep him silent on this bill, when any governor doing his or her job should have stood up like Mitch Daniels did last fall and proclaimed from the highest point possible that this bill had to be stopped because it will put states who are already facing deficits in even bigger financial problems. And for us to have to experience that alone, along with those other two very compelling reasons, is why we got to continue to fight every step of the way to make sure, if not fully reversed, at least major portions of our, because in this state we can't afford it. Sure.
Just one question. There's a lot of things that are contributing to the country's shape we're in. Our health insurance out of proportion, too much spending. My biggest thing is immigration. It's plain to see that the federal government is not going to do anything with this because they can start. What is your plans for illegal immigrants in this state? Because if the federal government doesn't do it, the state can. Do you have plans to do anything with this?
Yeah, a couple different things. One, you're right. I mean, I still don't think we should let the federal government off the hook, because in the end, that's the ultimate source of enforcement or change or improvement on that. Secondly, though, I think working with the Attorney General, J.B. Van Hollen has already done an aggressive job. I think their numbers are about fourfold what they were in the previous Attorney General in terms of individuals who are illegally in this state who then commit any sort of crimes that they've taken action not only to prosecute but to see that they were deported. I think that needs to continue. And third, in terms of the state government, we certainly should not be doing things that make it easier to be here. One thing I've already done, you remember 4 years ago when Kathleen Falk was running for Attorney General? She's the county executive down in Madison and Dane County. She actually told their staff not to check, to essentially ignore the law, not to check for public assistance, whether or not someone was a resident of this other county and ultimately the United States. We, on the contrast, even though I have a much larger Hispanic population in Milwaukee County, we clearly said, you got to enforce the law. We have been, and we will continue to enforce the law. Because I didn't hold a press conference, and I just did it. Even the leaders of the Hispanic business community, who are people who are there legally, just like every other immigrant group in the state and in our community, didn't object to that. Because we didn't single them out, we just said, we're going to enforce the law, and we did it. As governor, we're going to enforce the federal law with regards to immigration and legal status in this country, in the state of Wisconsin, just like we did at the local level, and not give any sort of benefits or breaks or look the other way like some elected officials have in the state before, because that's just fundamentally wrong. In terms of changes that will happen in the future, they have to change at the federal level. But we're going to make sure the laws are enforced, because I believe in the rule of law just like I believe our Attorney General does.
Not a question, but something I think you'll enjoy. I was having coffee with an old man about my age a week ago or so, right after Terry put out his brown bag lunch. And he said, why do Republicans have brown bag lunches? He said, we can't afford an 8-course dinner all the time. We're working people. I said, that ain't it, Bill. He said, that brown bag represents something. The brown bag represents the Republican platform that their candidates are responding to. He said, you could open it and look down in. He said, those sandwiches down in there are your candidates. And he said, you can look down in there and see that they're not full of baloney.